We are recording now. Excellent. I am Michael Mann. I'm the host of Planetary Health First, Mars Next. And we have an amazing special guest today, Dr. Robert Pearl. How do you want me to call you today?
Call me Robbie. Now that you've introduced me as Dr. Robert Pearl, now we're friends.
All right, cool. And that's part of a series I have too, Bring a Friend. So you can come on that show again with one of your friends too.
That sounds great.
All right. Well, tell us a little bit about yourself. Of course, many people know you. You've been around in healthcare for a while and you're doing some amazing things, but just let some that might not know you yet about you.
I went to medical school at Yale and then came 3,000 miles to Stanford. I took my residency in plastic and reconstructive surgery. I focused on fixing children with cleft lip and cleft palate, which I still do. I just went to the Philippines a short while ago and did a mission trip there. After being a surgeon for a while, I became the CEO in Kaiser Permanente, one of the nation's largest medical organizations, where I was responsible for the healthcare of over 5 million individuals. And after doing that for 18 years, I went on to my third career, which is what I'm doing right now. I teach at the Stanford Graduate School of Medicine and Business. I have a weekly podcast of my own called Fixing Healthcare. I write for Forbes, and I've written 3 books. The newest one, ChatGPT MD, How AI-Empowered Patients and Doctors Can Take Back Control of American Medicine, was published this week. It's already #1 on Amazon's new books, and all profits go to Doctors Without Borders, a really wonderful global charity.
Cool. Well, this is awesome. You definitely did way better than I could ever do with your bio. I know there's so many more things there, but thank you for doing such an amazing job on that. So succinct. I think you've done that maybe once or twice, maybe.
I've told people who I am every time they've asked.
So tell me, why, for those who haven't read, of course they need to go to Amazon and we need to pick up the book, but how is this AI really gonna, you really, come on, is it really gonna save healthcare, you think? Tell us.
It's important for viewers and listeners to realize what generative AI is. We talk about AI, there's lots of different kinds of AI. Generative AI has a unique ability, not just to provide knowledge, but expertise. If you look at advances across history, you had the printing press that allowed books to become available to a broad swath of individuals. You had the internet that became a source of information off of your computer. We had the iPhone, where information is carried in your pocket. But you can't get personalized expertise. You can get general information. Click on a link on Google, you can find out about diabetes, but you can't find about your situation. Mm-hmm. Generative AI changes that. It allows you to put into the computer application your entire genetic code, your entire medical history, your medications, your allergies, your family history. You can put in there your preferences. It can personalize it in a way that never existed before. And understanding that with that in place, and I want to add one more piece. What exists today is not yet ready for prime time. Anyone who uses it, and people should use it, should still consult a clinician. But it's doubling in power every year, which means in 5 years it'll be 30 times more powerful. So I'm talking about what's on the horizon and getting ready for that. And that is expertise. Generative AI will allow you to paint a picture that looks like a Rembrandt, even though you've never had an art class, to program a computer, even though you know nothing about programming information technology. You can write music in the style of Drake, and it sounds really good, even though you don't play an instrument. And it will allow you as a patient now, that's why I titled it, to become empowered, to have that expertise, to be able to make diagnoses accurately, and very importantly, manage chronic disease. 60% of Americans have chronic disease. It's 70% of the cost of American medicine. Its complications are heart attack, strokes, kidney failure, and we can do a far better job than today. And so the solution to American medicine, as far as I'm concerned, improve quality, improve health, thereby reducing heart attack, strokes, kidney failure. And that is how we make care affordable for America. Yes, I think it can revolutionize, transform medicine as we've known it.
Yeah, I think you're totally right. That picture you've, I mean, it's like everything, capturing everything that we need in healthcare. But what is the constraints? What would be the problem with it not being realized? Where do you think would be the bottleneck with human?
So there's two parts. The first one is short term, and it's a 5-part book. The fourth part is all about the challenges: privacy, security, misinformation. These are the types of concerns. When I wrote the book ChatGPT MD, I co-authored it with ChatGPT, and at one point, it made up an entire exploration of the North Pole that never happened. At least I couldn't find it in my research. Why every fact in there I counter-checked and referenced
Mhm,
actually in the extensive bibliography at the end. So it's not yet ready for prime time, but
mhm,
that's going to improve as the power increases. The biggest challenge is humans. It's doctors and patients. Patients alone won't be able to use it to maximize the advantages, and physicians and clinicians alone won't be able to do it. It's the combination, and that relationship, that partnership, has not been embedded consistently in the culture of American
mhm,
medicine. And that is what will have to be overcome. And I'll add one more piece. When we talk about improving health and avoiding disease, as a patient, I say, wow, that's wonderful. As a physician, I say that's wonderful, but deep down, I have a concern. What's it going to do to my income? If the patient is doing all these things and I can't bill for it, am I risking the financial security of my family? It's not a negative piece, it's just a human piece. And so we're going to have to transform the method of payment.
mhm.
We don't just reward you for doing things that intervene. It's called pay for volume. You get paid the same whether it does any good or not. We're going to reward value, keep
Mhm.
people healthy, avoid disease. You should be paid a significant amount for that. And that's not what exists in American medicine today.
Gotcha. I like how you say that. This is really, if done right, it needs to be aligned with value-based care and models. One thing I think would be interesting, and I wish was able to read your book, and the thing that I'm curious about on two levels. One, I see it being a really companion R2D2 for the doc, if the doc would allow that to be empowered, their decisions, but also for individuals. So, do you have anything that you discuss in that from a patient perspective, like a peer-to-peer support? Because it's like the hardest thing, and as a patient or person, is, I got on the bike today for 30 minutes. Nudging, I would say that with AI could help it, or is it specifically the approach that you're doing, or is it both patients and both doctors, how it can empower them?
In terms of clinicians, I tell this story in ChatGPT MD about a doctor that I know who was in an operating room, had just done a major surgery on a patient's neck. And the patient was having problems following the anesthetic, end of the anesthetic, because the vocal cords were coming together and occluding the airway. This was unexpected. The surgeon knew that she hadn't done any damage to any of the nerves or the muscles in the neck, couldn't understand what was going on. Opened her iPhone, went to ChatGPT, put in the information, and within a matter of seconds, found the case report of the same thing, that in some patients, the local anesthetic that is used diffuses and affects these muscles. And if you wait 30 minutes, it'll all be better. So they waited in the operating room, making sure it was safe. And lo and behold, the patient was great and went home. If this without the ability to access that information quickly, it's likely the patient would have gone to the ICU, maybe had to be re-intubated, maybe had a tracheostomy. So that's how clinicians can use it. We know there's 400,000 patients who die annually in the US from misdiagnoses. That's another way that clinicians can use it, to have a second opinion when it comes to complex procedures. For the patient, what it does, as I said earlier, is it allows patients to get medical expertise. Let's say it's 11 o'clock at night and your child has 102 fever. What do you do? Do you go to the ER where you'll wait for at least an hour or two? Will you be surrounded by people who are very sick, coughing? Or do you wait till the morning, see your pediatrician fearful that across that time, something devastating will happen if it's a meningeal infection, meningococcus infection. When you put the pieces together, what you need is expertise. Now, I'm not saying the technology is going to be perfect for the patient, but what I am saying is that it'll be better than what exists today. Because today you have nothing. You have to take a guess. You got to call your grandma. You go on Dr. Google and you find out general information. Call a doctor's office. What does it say? Go to the ER, because that protects the doctor. It doesn't tell you anything that you really need to know about you and your child. Does your child have a history of a medical problem that would put them at great risk for infection? Well, that's going to be a very different answer than if they're very healthy. Are they looking like they're what we call flaccid, listless, lying in bed, not moving? Or are they riding their bike around the living room? These are the kinds of questions that allow an informed decision, expert decision to be made, and generative AI will facilitate that. But between people, generative AI, like any other new technology, requires experience learning how to use it. Called prompts. You've got to put the information in. You got to learn how to put it in. It's not that hard. You just got to learn it like any other skill. First time you get an iPhone, you don't know how to use it. Over time, you figure out how to use all the various applications, how to be able to obtain the information that you need, how to be able to translate from one screen to another. This is just the tools that need to happen. And I'm hoping that it'll be led. I'm hoping that major medical societies will create these tools for patients. And I'm sure that patients will create better tools for each other, because that's the history of technological application. So yes, I'm envisioning a community and a partnership.
Are you involved in that, the committees? It seems like the biggest concern I have with ChatGPT and just what I see is it's great for generalizing, but like you said, all of a sudden you get some bizarre, like, hey, if you say create the greatest resume for this candidate or whatever, and of course they're going to add something that's the greatest that they probably didn't accomplish. So it's, what do we do to create safeguards, guardrails to make sure we're doing what we really want?
Well, that's education. I mean, I'm an attending physician and I have residents. When they write something, I double check it to make sure I agree with everything that's gone into place. It helps me, it facilitates me. As they get more senior, I check less. As ChatGPT evolves, people will check it less, as it's been demonstrated by studies and research to be more reliable and accurate and to have very few hallucinations. It too will become more trustworthy. But you're raising a really important point, which is going to be that this is not about taking the human out of it. This is about creating a partnership. And that's why I talk about the empowered patient and the clinician. That's why I talk about the triad of dedicated clinicians, empowered and educated patients, and generative AI. The three together, and again, I'll go back and stress, doubling in power every year means that within 5 years, it'll be 30 times more powerful, the equivalent of your car going as fast as an airplane.
It's just crazy. It's so hard to believe that lack of the just exponential, I guess, Moore's or whatever you want to call it. So what do you see? You're a futurist in many ways, I would say. I mean, is that correct? With healthcare and some, I mean, I hate terms, but anyway, in this case.
I think the skill I have is to look at what exists today and understand what's going to happen tomorrow, and then how to connect those two dots going forward. I think futurists just look into the future. I'm the person, I think of myself as a strategic leader. I teach strategy at every business school. And it's how to convert a vision of what's going to happen in the future from where we are today.
Okay. So that's probably a better accurate take, as this would be like as a strategist saying, this is where it is today and this is where it's going. And this is how I can be that conduit. And so with that, what are the systems, the things you're putting in place as you've written this book? Are you getting with major corporations, these tech companies, hoping to kind of advocate on behalf and these doctor associations and organizations? I mean, I imagine the biggest one is the physicians. The physicians need to be at the core next to it, together with the, I guess the patient advocacy groups is another thing, but the tech and physicians, how does that come about to coalesce to make this a reality?
Well, I only published the book 2 days ago, so it's hard to exactly say. And
All right.
since that time, I've responded to probably thousands of emails and messages, 99% of which were very positive, and it's how it became #1 on Amazon's best new book list. But I think over time, I've been an educator my whole career. I train doctors, I train medical students, residents. I teach in the business school. I want to train the next generation. I also speak at conferences, and some of those are business conferences, technological conferences, medical conferences. So I see a lot of my role as helping people to embrace the future. When people ask me, what is a leader? A leader is someone who makes things happen that otherwise might not happen. They're able to see something before others, and they're able to align them around it and motivate them to take the risks and have the courage. That's the role that I see. That I can play. It's what I've done across my entire medical career, both as CEO in Kaiser Permanente and now as a commentator and writer and podcaster. Hopefully this book will be a major step in that direction. The big thing I'd like to do is open people's eyes. You think about American medicine, you think it's pretty good. And we have great clinicians, doctors and nurses. We have people who are very dedicated. But when you look at the outcome, our life longevity is no better now than it was in 2010. We rank below all the other industrialized nations in clinical results, including life expectancy. We have the highest maternal mortality, the worst childhood mortality. 400,000 people, as I said earlier, die from misdiagnoses, 250,000 from medical errors. Over half of the country says healthcare is not affordable. 70% of patients say that the medical system needs radical overhaul. 60% of clinicians are burned out. We could go through a whole litany, and we have to accept the challenges. And it's not a reflection on the people. They are hardworking. They are being overwhelmed by the demand. The system is out of control. I think about that as sort of the Sorcerer's Apprentice in a Disney film, where these brooms have taken over the person supposedly in charge of it all. That's medicine today. We're running on treadmills going ever faster. Generative AI, I think, offers a solution. It's not an easy one. It's not a quick fix. It's not a guarantee. But finally, we have a tool. I've been writing for over a decade, my 2 previous books, about what should be, what must be, what has to be, what's better for patients. And I think my insights were accurate, but nothing much has happened. And why is that? Because we haven't had the tool to translate the potential into the reality. That, to me, is what ChatGPT does. And the more people who get involved, and by the way, as I said earlier, all the profits go to Doctors Without Borders, but the more people who buy the book and talk with each other and have discussion and express fears and concerns, the better the likelihood, the greater the likelihood that it'll be a tool to maximize health and improve the lives of 300 and some odd million Americans.
So I guess with ChatGPT, that's the open AI, are we hoping that there's going to be greater innovation from this with multiple startups in order to prevent just one side's of one company benefiting? I mean, what do you hope in this in order to actualize this? Because you've written the book, you're a strategist. It seems like we're going to need to have an ecosystem in order to accelerate this.
One of the hardest decisions I made about the book was what to title it. And I used ChatGPT because that then blended nicely with MD. I thought that was a good title. But on page 1, I note the fact that it's not ChatGPT, it's all of the generative AI tools. Google has one that works very well. Microsoft certainly uses the OpenAI format. You have other companies, you have startups, you have a variety of people. And so I see different tools, different applications becoming available. And by the way, the ones that exist right now are not identical. And it's not just that they differ in power, they differ in personality. Because, I tell people, GPT really should be PTG. The P is pre-training. They're all downloaded with a massive amount of information from the internet, from social media. The training, though, is what's called parameters. They're the rules you give it. As an example, in medicine, we want to tell it to use newer journals over older journals for information. You want to use ones that are so-called peer-reviewed, ones that have higher what's called impact factors, which is how often they're quoted by others in the field. So that's a set of commonly accepted rules. But what topics can they cover? Should they respond to you in a particular tone, in a particular kind of voice? These are actually differences. And if you use each of the tools, you'll see they're slightly different. And you got to decide which personality you like better. The same way you maybe use bedside manner to pick which clinician you want to be seeing. So there are differences, but to your point, there's a lot of competition. And I, again, highlight the fact that I use ChatGPT just as a simple label. I could use LLMs for large language models, or I could use generative AI. There's a lot of terms I could have used. ChatGPT seemed like the simplest, and everyone would recognize what it was.
Well, I think you did well, right? Because you're already 2 days in and you're selling pretty good on Amazon. And if you put LLM, they might not know what lunch they had for whatever midday or whatever. You know, I talked one time several months ago, and the guest was talking about LLMs, and someone was like, didn't know what it was. So to your point, I think you were very, very wise with the title. So
thank you.
Well, so I really, really appreciate you coming on today with this, because I do think this is super important. And I really do hope that I have my own little R2D2 in 10 years that helps me out. I would love to think my dad, who's 90 something, would have his own, and not that it would be using large language models or whatever, but it seems that we're at a point now in the next 10 years where we could have robotic assisted devices using generalizing intelligence. That's a whole nother subject, but I do think when I hear the argument for ChatGPT, there is a lot of that. Everyone should have their own little helper or friend. And so I could see that one day. What is this future going to look like? And I talked a little bit too long on that, but I'm going to stop there.
I think the future to some extent is already here. It's just that it's the dawn. And for people like you and your dad and anyone else listening and watching, you should try it. I was on a podcast earlier this week, and at the end of the show, often the podcast host, the guest, talk for a little bit. And she was saying, you know, my husband had a problem. He was skiing and he hurt his shoulder a month or so ago, and it's not getting better. He's not sure what to do. And I said, I think I know what's wrong with him, but why don't you put all the information into ChatGPT and see what the diagnosis ChatGPT comes up with and the treatment plan? Lo and behold, she texted me back and she said, my gosh, it knew exactly what he had. It had the right diagnosis. It recommended the MRI. It said he's probably going to end up with surgery. If you hadn't told me to do that, we probably would have waited 6 months and it would have been too late. That is the opportunity that exists right now. You didn't hear me say it told him what to do. It gave him the information to now contact the clinician, which is what he did. He called the orthopedic surgeon to be able to have the appointment. Without that information, he would not have had it. So I would, number one, encourage people today to use it for information, for questions. And by the way, they can be questions on health. You want to have a healthy diet? It will give you recipes and shopping lists and tell them the specific problem you have. You have celiac disease or gluten problems. And it doesn't matter. The more information you give the application, the better it's going to be. And as I say, memory is going to be available, announced by the company. It's going to be growing across time. But also put in some of your diagnosis. If you see a clinician, put in all the information about your problems, all the stuff you would have told the doctor. See what it comes up with. Experiment and play with it. Don't use it for the final answer, but use it to educate and train yourself. But that's today. What do I see in the future? Number one, one of the things that we've had now for over a decade is what's called wearables. These are monitors. It can be on a watch. It can be clipped onto your clothes that can tell you your blood pressure, your pulse, your heart rhythm, your blood glucose. You can go down the list of opportunities that are there. And what happens to all the information that's there? Nothing. Why does nothing happen? because there's no doctor in the world who wants all that information. It would overwhelm the IT systems in their offices. They don't have the time to look at it. Does that mean the information is not valuable? Of course it's valuable. We just don't have a mechanism to use it. That's going to be one of the pieces that are there. In the fall, OpenAI put in place plugins, GPTs, that allow that data, that will allow that data, not yet today, to be able to be easily downloaded. What else do we know? We know that the electronic health record sounds like it's a single system, but every doctor has their own and they don't communicate with each other. They're not connected. All your data needs to be in a common place. We can figure out how to put that into a common database, including your full genetic code and information sequencing. Those are the kinds of opportunities. And now suddenly, if you have a chronic disease problem, whether it's diabetes or hypertension, you can monitor it and know how you're doing every day. Take diabetes. This is a crisis in the United States. It's estimated that 30% of Americans are have either diabetes or pre-diabetic. How well do we control diabetes in the United States today? Terribly, less than half of the time. I don't know how many listeners and viewers are aware of that. Imagine what this technology could do by being better able to manage your blood glucose using a plugin from your clinician, helping to be able to better sort out the doses that you should be taking of the insulin or the medications, being able to figure out when you don't have a problem. We're talking about going from episodic care in the doctor's office every 3 to 4 months, to daily care, to continuous care. It's talking about an entire revolution. And I keep making the analogy, as I talk to more and more people, to the cell phone. You know, we used to have a phone in our kitchen that we would use when we were in our house, or we'd have to find a phone booth to be able to make a phone call. That was the telephone, episodic. The iPhone is now a continuous source of information, a continuous source of expertise with a range of functions that it can do. That's the way to think about it in American medicine in the future. I think it's going to be even more significant than the introduction of the stethoscope was in the past.
You get me worried about the ChatGPT. I have lower back issues, and I know the data is 50% of all lower back surgeries are sometimes or possibly unnecessary or preventable from whatever, it's, and I'm sure there's other data that says that. So I don't want it to tell me that I need surgery on that. I've been doing everything I can to do physical therapy, all this other stuff, and it just won't go away. And it's an interesting thing. So anyway, I know you don't do practice medicine like that anymore. I'll stop. But you got me thinking a while back when you were saying that. So I probably will try, but I'll play around with ChatGPT on that. But
it also will educate you. I have a chapter in the book about the Khan Academy. I don't know if you follow that at all in education. It essentially flipped education on its head. So rather than going to class and learning something and going home and then doing your homework, you go online before class and you learn the material. And then in class, you have the conversations and discussions going deeper, because now you already have not just knowledge, but some degree of expertise. I think the same is going to be true for ChatGPT. I think it's going to reinforce and improve the doctor-patient relationship. Because now, if you had, maybe way back at the beginning of your back pain, had consulted ChatGPT, you would have had enough knowledge to ask all the right questions about the surgery and the improvement in your particular case, and whether your specific situation is related to a disc, and what does that mean relative to the fact that a lot of people have abnormal x-rays but don't have pain, and people have pain and abnormal. You'd have a whole series of questions that you'd be able to understand your doctor's thinking and recommendations. And it wouldn't be ChatGPT telling you to get surgery. It would be a clinician telling you to do it. But you'd be able to understand that recommendation, understand when it was being recommended and probably not indicated, or when for whatever reason it wasn't being recommended and it was the best solution. I think it would improve that dialogue and conversation, and you'd leave the doctor's office understanding exactly what was said. And today we know that the majority of patients, after leaving the doctor's office, don't really understand what the clinician said.
So when do you see yourself, or when do you see as a strategist with this actually filtrating in to healthcare?
I see generative AI already in healthcare. It was interesting. I I have a monthly newsletter, and anyone who wants more information could go to my website, robertpearlmd.com. But I have a monthly newsletter that's free. There's no subscription costs or anything. And about 60,000 people read it. And so there's a lot of people who knew this book was coming out. They didn't know anything about the book. It wasn't published yet. It wasn't even yet available. I did put a couple of chapters up in the public space for people who wanted to read a bit about it. But at this point, they knew nothing. And I received dozens of letters from clinicians. And they all said the following, Robbie, I know you're writing a book. You probably don't realize how powerful this technology is. I'm a clinician, they told me their specialty, and I put in all the information as though I was a patient about a problem that they had. And I wanted to see what ChatGPT would say was the right workup, evaluation, treatment, etc. And it was almost exactly identical to what I told the patient. I was amazed at how reliable and accurate it was. And of course, I knew all this stuff because I had done the same thing at the start of my research. But also, I didn't tell them that I thanked them very nicely for sending me the information. But I think that that's where it is. I think we're at the point now where it's really good. It's not perfect, and really good is not good enough for medicine right now. You need to have the clinician. But at some point, it's going to become good enough that compared to the alternative that exists, the middle of the night calling the office and getting the answering machine or going to the ER because you have no other choice, it's going to give you a better answer. And instead of just going to the doctor with an array of symptoms that you can't put together in a way that makes the most sense for the physician evaluating you, it's going to help you in that process. And a big next step, it's not out right now, but it will be coming out, is voice recognition, where it's going to have a voice conversation as though it's a clinician. And it's interesting, when I wrote this book, I said to myself, maybe I'm being too optimistic. The time frame really won't be as quick as I said. And then 2 weeks ago, what happened? NVIDIA announced that it would be producing an AI nurse robot that would be able to make diagnosis and provide expertise around chronic disease. And I said, oh my gosh, I was overly conservative. Almost here. I thought it'd be 2 years, and now it's been 2 months. So I think that's going to move very, very, very quickly.
What is this? What is the details of the nurse robot? I mean, is it actually like a humanoid, or is it just the actual? I know robot, we use that term loosely.
Well, the pictures they show, because it doesn't yet exist, the pictures it shows looks like what you and I might think of as a cartoon-like robot. Whether that's the way it's really going to look like, I don't know. I mean, it looks like, a little bit like a nurse might look, but it's obviously a machine. But as I listened to the demo, and of course, demos are just demos. They don't. I never take them as the final answer. It basically performed the way a nurse advisor would if you called a telephone center. A nurse asked questions of the patient, provided information. The patient asked a question about an antibiotic, whether it would have a cross reaction to a penicillin sensitivity, and the bot said no, it doesn't have that problem sitting there. It asked a question about management of chronic disease. And so it served, I would say, almost identical to what we call the scripts, the things that we give nurses who work in telephone centers providing advice to patients. It had the same outcome on a consistent basis. Now, what will it look like when it's finally released? I don't know, because they haven't released it as of yet. But the fact that they're willing to announce they're going to be providing it, for a decade, I've really pushed Apple and the CEO of Apple to create a tool that would allow patients to put in information about their chronic diseases and know how they were doing. You take something like the Apple Watch related to atrial fibrillation. The company designed it for people who don't have atrial fibrillation or just know they don't have it. Why not do it for the people who have it? And the reason is the fear of the company that gets sued for a medical mistake. And it's large enough that if you do anything 1,000 times, I don't care who you are, a doctor or a machine or an application, there will be a mistake. And when it's a doctor, people forgive it. And when it's Apple, they sue them for billions of dollars. So Apple has never done that. And Google announced that it wouldn't do it. And I was fearful that no company would take the risk of creating such a tool. And lo and behold, here NVIDIA is going to do it, or at least announces that it's going to do it. And in exactly the same ways that I describe in ChatGPT. Diagnoses when you don't know what you have, chronic disease management, information deciphering what your doctor tells you in the office, being able to answer the kinds of basic questions we would ask to a nurse if we were talking to a nurse on a telemedicine visit or over a telephone call.
I can tell that you don't sleep any, and when you do, your brain is just going full force on all these things.
Yeah, I sleep about 4 hours a night, so I do rest it for 4 hours, two REM cycles, but most of the other time it just flows. To me, it's just a form of creativity and art. You know, I tell people who ask about leadership in general, do people do it for the money? And maybe there are some people, but I think most of the people do it in the same way that painters paint. They don't paint to sell their paintings. They paint to create the paintings. And I think that it's an artistic pursuit, making things happen that didn't otherwise exist, bringing to life visions and forms that others haven't yet seen, giving someone an aha, an insight. And I think that that's, you know, what I always try to do in my teaching at the Stanford Medical and Business School. It's what I've done with residents and medical students. And I love it and enjoy it. It fills me with energy. And I can't wait to get up in the morning and be able to figure something else out that someone else hadn't seen. It's just the joy that I enjoy doing.
So it sounds like it's two-part. It's the creative, the process. It's really the pursuit of this process that's never ending. I think that's the delight, like the creative, the artist. But I also do think even an artist, the actual part of someone delighting in that creative process, it is a two-way thing. I do think there are some artists, the starving artists, that might hide it underneath their whatever and the process alone. But I do think part of the process is the actual where someone there is some sort of creation where there is a value to it. I maybe not at an auction or Sotheby's or whatnot, but I think for you, they're also you are creating something where the community we're receiving this. You know, it's not like you're writing books and you know, in hiding. You know, so we are your students are getting a lot out of this immensely, and so I really appreciate you coming on here and sharing this. And you know, it's just the beginning of this time period. So as we kind of wind down towards the end, what would you like to happen in this journey that you're on and you're doing? It seems like AI is a big part of your work.
I think it's a big part of the future of medicine. So it happens to be where I am in my work because it's what I see to be the next best thing. If I thought there were other opportunities, I'd probably pursue those. I mean, my goal is, how do I help improve medicine, improve the health for all of our nation and ultimately for all of the world? I'd like everyone to buy the book, ChatGPT MD. Remember, all profits go to Doctors Without Borders, so it's not buying it to provide me with income. And then I want people to engage in conversation and debate. I want them to talk about the challenges, their fears about privacy, bias, security, misinformation. I want people to talk about how they feel about getting care. You know, it's interesting if you go back to the early days of any technology. You know, when ATMs came around, people were afraid to put money in it, that it'd be lost forever. You know, I remember when my dad got his first iPhone, he kept it locked in the trunk of his car because the only thing he could think of to use it for was if he got into an accident, needed to call for help. Yeah, this is the early stages, and the way you get over it is you talk about it, and you know, people might not believe me, but they'll believe their parent or their kid or their cousin about, oh my gosh, I used it for a certain purpose and it did some good. They have to learn how to use it and share information. You know, I think what we need is discussion and debate. There's a lot of psychological literature that says for transformation, that's what I believe American medicine needs. My first two books were about the problems, and everything I wrote was accurate, and they still exist. The challenge is, how do you transform it? How do you make the change happen? And the psychological literature says it takes about 25% of people to do it. So we need to reach out to large numbers of people, swaths of individuals who will try it. And once 25% of people have tried it, have figured out what to do with it, and are using it on a daily basis, then the numbers will grow, and American medicine will change, and it will shift, and we will be able to restore health and make care affordable and make quality better and eliminate what I think is 500,000 or more deaths a year that could be prevented, ones that really are tragic. You know, in my first book, I wrote my dad who died from a medical error. He shouldn't have. If generative AI had been widely used, that information would have become available, and he would be able, probably not alive today, but he would have lived for quite a number more years after that.
I'm sorry to hear about that. Well, I really appreciate you coming on, and I can call you Robbie.
Please, all my friends do.
Cool, cool. Well, is there any last minute things you want to share? I mean, this is your time, not mine.
I think we've said it. I just want to encourage people, read the book. If you like it, write about it. If you don't, let me know about it. Tell me what you disagree with. I think this discussion and debate is what needs to happen. I don't want it to occur over a decade. I mean, that's what happens with most technology. It takes an extended time period. I write in the book a little bit about a variety of inventions. Not an invention, but vitamin C as a cure for scurvy was discovered 250 years before it became standard. The Fahrenheit found out about the thermometer 100 years before doctors started carrying it around in their bags. We see a huge gap. The research shows it takes 17 years for a great idea in medicine to become common practice. We can do a lot better than that. I'd like to see generative AI be a fundamental part of how we provide care in a 3 to 5 year time period. And I think we need to recognize that we have to empower doctors, but we also have to empower patients. And together, an empowered physician and an empowered patient will achieve better results than either one alone.
Well, Robbie, when I'm hearing this, I feel like we really have big, powerful stakeholders in healthcare. How can we? What are we doing, or how can you, with your, your reputation and who you are and all the hard work you've done, what can you do? That 25% is a large number. It seems like going through with different organizations, different leadership. Can you tell me what you would do if that was an opportunity for you? What kind of organizations would be pinnacle to really accelerate these conversations to make this happen?
Let me unpack a comment you just made, which is, yes, there are a lot of large organizations, and some of them don't want to see this change happen. They're making way too much money today. It's why in the book I talk about seizing back control from the corporate entities that are becoming very wealthy for themselves and for their shareholders today. But there are other entities I also write about in the book, the retail giants, the Amazons of the world, that are also moving into this space, that are figuring out ways that they can lead the process of healthcare. They're acquiring medical groups, they're acquiring physicians, they have pharmacies, and they have a customer-first mindset. You know, if you want to order something and have it delivered to your house the next day, you can get it the right item at the right price, delivered efficiently, easily. Tell me where you can get that in medicine today. It just doesn't exist. And so I wouldn't necessarily say it's that they won't come in and be a solution, but I believe the solution would be better if it's led by clinicians and patients. I just think they're closer to the direct doctor-patient interaction and intersection, and will do so in a far better way, which is why I encourage them to do it. It's why I wrote the book. And I think they have to realize that if they don't do it, and it may not happen, but if they don't do it, if they try to protect the turf that exists, if they try to stay in the past, they try to cling to what exists right now, if they say, oh, okay, we'll use it for administrative tasks, but not for clinical tasks, they're going to get left behind. And all I can do is give them the warning, point them the direction, point out who will take over, point out what might happen as a consequence of that. So again, I'm not on the show or writing the book to tell people, oh, this is definitely going to happen, or this has no problems at all, or this can be a slam dunk. No, I'm pointing out an opportunity. And I'm saying, I don't know who will seize it, but someone will seize it. Of that, I'm absolutely certain. Clay Christensen, who was a friend of mine, passed away, unfortunately, from a tragic problem, he
Mhm.
talked about disruptive technology. And he points out that across the history, the incumbents always have the answer before anyone else.
Mhm.
Kodak had a filmless camera. They could have had the digital camera 2 decades before Apple brought one forward, but they didn't. They didn't because they were making too much money selling film, which was really their core business strategy. And we can go down a list of companies that clung to the past and then got disrupted by someone else coming into the marketplace. And that will be the story of medicine. You know, we've known for a long time about its problems. We know about its challenges. We know that it's been an inefficient industry with very hardworking people, but not
Mhm.
with the types of efficiency that would provide greatest value for the customer, in this case is the patient. This is the opportunity. This is a moment in time that only comes around occasionally. And it's here right now. We're at its dawn. And I'm just encouraging everyone listening to join in, to, if you're a patient, to try it. If you're a clinician, to figure out how you can help your patients. You too need to try it, but then you need to figure out how you can teach it, because that is the role of a clinician in medicine for millennia. So I think we're at that point right now. I know my preference. My preferences will be led by the clinicians and by the patients, but I equally know as a business school professor that if they don't do it, someone else will. I predict it'll be the retail giants. I actually think that might not be so bad for the patient. I think they will respect the customer because it's so intrinsic to their brand. But I can tell the providers of care that they're not going to care as much about that. And we know that from a lot of other conflicts that have happened. They're going to put the customer first. And I guarantee that the providers of care will regret the fact that they lost the opportunity to lead the way.
What do you think if you had to bet on it? Do you think so it sounds like you feel like the retail customer focus will win this and the providers and clinicians will lose out on this?
I don't know. You know, if you'd asked me that question 6 months ago, I would have said that's probably going to happen. And yet I am so thrilled by the number of clinicians who are writing to me, who tell me about
Okay.
their energy and their enthusiasm. Now, these are individuals and groups. These are not yet the large organizations. But when you get enough individuals and groups, then it becomes embedded in the larger organizations who stop seeing their job as protecting their members from evolution and change, but actually driving the process on behalf of their members, because that's what their organizations are designed to do. So I think I have a new enthusiasm. You know, I'd say the betting odds have now shifted, and a toss-up is probably where I'd leave it today, 2 days after the publication of the book.
And they do have some good clinicians and providers at these retail giants too, so well, this has been phenomenal having you do a deep dive on this, kind of pulling all the tea leaves out, pulling all the layers of the onion, really unpacking this. I really appreciate, Robbie, that you've been able to come on today and share all your knowledge with what you're doing, really leading the charge.
And if people go to robertpearlmd.com, they can get a lot more information, and they can also let me know their thoughts on ChatGPT, the book, and ChatGPT or ChatGPT MD, the book, and ChatGPT, the technology.
Awesome. Well, until next time, friends, thank you for joining us live on Planetary Health First, Mars Next.